Hello, my name is Hattie Kaufman, and I'd like to talk to you about some very big changes in our nation's healthcare system and what it means for us as American Indian and Alaska Native people. The Affordable Care Act, which became law in 2010, opened the door to health insurance coverage by expanding Medicaid and providing free or low-cost insurance options for millions of Americans, including you and your family. Under the Affordable Care Act, American Indians and Alaska Natives can get free or low-cost health insurance. This insurance can be used at your local tribal, urban Indian, or Indian Health Service clinic or hospital, or at any other qualified health provider in your community. What's new is that when you enroll in a health insurance plan through the Health Insurance Marketplace, you can still get services from the Indian Health Service, tribal health programs, or urban Indian health programs. Plus, your insurance will pay additional services your clinic can't provide or are not offered by your local clinic, but you need for good health. Application for enrollment begins in October 2013, with coverage starting January 1, 2014. You can apply online. There are trained staff and online instructions to help you with the application process. If you need help filling out the application, there are special assisters to help you, so just ask at your local clinic. With health insurance coverage comes peace of mind. Knowing you have health insurance coverage will reassure you whatever arises. Necessary surgery, hospitalization, or referral to a specialist, you are covered. This is a big change. No more waiting on a medical priority list to cover special care. You will be covered. If you're American Indian or Alaska Native eligible to receive medical care through IHS, tribal clinics, or urban Indian health organizations, you can have certain benefits and protections, including no deductibles or copayments if you continue to use your IHS, tribal, or urban Indian health program. No premiums, enrollment fees if you are eligible to use an Indian health or urban Indian program, and no deductibles or copays for Medicaid. No out-of-pocket expenses if you are enrolled in the Children's Health Insurance Program, CHIP. You will not be assessed a tax penalty by the IRS if you do not have health insurance. Plus, if you're an enrolled member of a federally recognized tribe, you have benefits in addition to the ones I just mentioned, including no deductibles or copayments if your household income is below certain limits, $70,650 for a family of 4 in the lower 48 states, or $88,320 for a family of 4 in Alaska. And you can enroll during any month of the year, instead of waiting for an annual enrollment period. In addition to the special provisions offered to American Indians and Alaska Natives, our people are also covered by the basic benefits of the Affordable Care Act that apply to all U.S. citizens. This means you can't be denied coverage because of a pre-existing condition. There's no lifetime limit on how much care is paid for if you get sick. Your coverage can't be canceled if you get a serious illness. And preventive health care is covered, like mammograms, flu and pneumonia shots, and well child visits from birth to age 21. The Affordable Care Act honors our unique trust relationship with the federal government as Indian tribes and Indian people. Special provisions continue so that certain payment from Indian land or treaty rights and money from the sales of items of cultural or traditional significance won't be counted for determining Medicaid or CHIP eligibility. So, how do you apply? Starting in October, you can fill out an application on healthcare.gov or by telephone, or you can ask your local clinic or hospital to help you fill out a paper application. Your information will remain confidential. There is a special section on the application just for American Indians and Alaska Natives. To take advantage of the special benefits and protections, you must fill out the full form and the section for American Indians and Alaska Natives. Whether you're an enrolled member of a federally recognized tribe or a non-enrolled descendant of a tribe eligible for IHS, tribal, or urban Indian health care, you may qualify for these special benefits and protections, but you must apply. On the application, you will be asked Social Security numbers for you and others applying for coverage, employment or income records, information about current health insurance, including information about employer health coverage, if you are enrolled in a federally recognized tribe, if you have ever received health services at an IHS, tribal, or urban Indian health clinic, how much income you receive from Indian land, natural resources, and items of cultural or traditional significance. This information is needed so that these types of income are not counted against your eligibility for Medicaid or CHIP. When you enroll in this new free or low-cost health coverage, you'll have the peace of mind knowing you are covered. Also, your IHS, tribal, or urban health program will be able to bill your insurance, bringing in much-needed resources for our community's health programs. When you need to see a specialist, you will be referred to one. And you will not have to wait to see if there are contract health service or CHS dollars available or replaced on a CHS waiting list. Our American Indian and Alaska Native communities have done a lot with very little for a long time. We've worked hard to protect the federal trust responsibility to provide health care to our people. Now many more of our young, old, married, single, employed, unemployed, those with children, and those without children have health insurance options. Our people, including you, deserve the best coverage available. So protect yourself, protect your family, protect your people. Ask about applying to the health insurance marketplace today. To learn more about the health insurance options available under the Affordable Care Act, Medicaid, and CHIP, go to www.healthcare.gov or ask your clinic provider or business office for an application. If you will need assistance filling out the application, please contact CMS at 1-800-318-2596 to get the additional assistance needed. If you are a TTY user, please call 1-855-889-4325. We want to make sure no one misses out on gaining access to this insurance opportunity.